welcome to our Under the Hood of Menopause event. I'm Elizabeth Elfenbein. Most of you know me, but for those who don't, I'm the founder of Under the Sisterhood, and we are a social impact organization and company that is powered by intergenerational story sharing. And we believe that sharing stories not only educates, not only provides advocacy, but inspires action. And so our intention in all of these monthly events is to inspire, to educate, to bring forward conversations. Today is a really important one. October is not only Menopause Awareness Month, it's Breast Cancer Awareness Month. It also happens to be Mental Health Awareness Week. And so it's really important, as we see it, it's an opportunity to educate, to really fuel conversations and stimulate and bring in experts around all the different aspects of these stages. And so I'm just absolutely delighted today. I know it's a small group of us, but I think this panel is really important for multiple reasons. When we think about menopause has many different phases. Last month in September, we had Under the Hood of Perimenopause. This month, we focus on menopause, but when you think of menopause, there's the different, and I don't want to speak for Dr. Taniqua Miller, but there's the different stages from perimenopause to menopause to post, and of course, she will speak to that. We'll also speak about menopause happening naturally, also medically induced menopause that occurs from different illnesses and different treatments that might bring it on. We will look at the different stages and we will look at the different aspects and we'll look at longevity. So when we think about the phases of menopause and we start looking into what is, living actively, and what does this next chapter represent. So I'm really, truly excited about this conversation. I'm going to get going if it's okay with everybody. I do want to introduce Amy Danielson. She is in our programming group, and she will moderate the Q&A at the end. So if you have any questions, please feel free to add them into the chat, and we will be. And also, we've been very active with the chat, so if everybody would engage there as well, I think it'll be a wonderful conversation. So awesome. So I am going to open it up, and I will introduce first Dr. Taniqua Miller, who is a board-certified OBGYN and NAM-certified menopause expert. She is the founder and CEO of Revival, a telemedicine experience that provides an intimate platform for people to explore not just the physiologic changes of the menopausal transition, but the psychosocial challenges that lie ahead. Dr. Miller is also an Under the Sisterhood advisor and our first Women's Health Expert Council member. So welcome, Dr. Miller. And I'm going to ask the first question. You've shared that menopause is one of the most under-discussed stages of women's health. What do you wish more women and healthcare providers understood about this transition?
So glad to be here. Thank you, Elizabeth, for extending the invitation to meet with this group. You know how I absolutely adore Under the Sisterhood and really its intergenerational wisdom. And so happy to be here in my capacity as an OBGYN and as a menopause expert. I've been in this space for over a decade. So when I graduated from residency, I thought I was going to be the obstetrics extraordinaire, obstetrician and gynecologic surgeon, and very quickly realized just how underserved the midlife population within GYN was. And as I think of this question, what I wish we as consumers of healthcare, we living in our own bodies in our midlife transition is realizing just how dynamic this time is. And that because it's dynamic, our care should reflect that. And so, unfortunately, I think we do a really good job, even like when we look at other reproductive neuroendocrine transitions, whether it's puberty or pregnancy, we acknowledge that you need more touch points, right? You think about it's the teenager, there's lots of different touch points. You have a school structure where you're meeting with the counselor, you're taking health classes, maybe your parents did some extra education and learning around what's going on with your body. And then you have those frequent appointments with your pediatrician. You have the coaches, you have so much structure as a teenager, and there's a lot of support around puberty. And then pregnancy, I mean, come on, it's like 12 doctor's visits throughout the course of the pregnancy. I remember the weekly appointments where you have to go in and you're receiving a lot of education about what to experience and then all of the support in the aftercare, even from family, right? Like you have the baby showers, the gender reveals, and all of this excitement around the pregnancy and so much support. And then you get to midlife, and it's this very ambiguous, doesn't really fit like the straight and narrow pathway. It doesn't have this very prescribed period of time, right? You might have symptoms in your late 30s or your early 40s. You don't know. Your doctor doesn't know. No one knows. And so you're navigating this like very challenging takes. Oh, and go see your doctor once a year. And I just wish that patients, and I talk about this a lot, is that your annual exam, when you have 7 minutes to like talk about your entire year, is not the time that you want to really explore how to optimize and thrive in this yet another neuroendocrine transition that really is going to set the stage for what the next third of your life will look like. And so I wish that we had more of an understanding as people living in our bodies through this transition, having access to that care so that you can have those ongoing conversations with someone who actually knows how to guide you. I wish that healthcare providers knew about menopause physiology, understood how it evolves and changes, and how we need to show up differently as we're caring for patients and providing recommendations depending on where they are in their own transitions. I'm seeing so much, and I love all of the attention that menopause has gotten. And I'm in all the Facebook groups in my neighborhood. And it's so interesting just to see that people are going to the Facebook group for medical advice. And I will tell you, I'm so grateful I'm in those groups because not all of the advice is actually correct.
Mm.
And I'll go in there and be like, respectfully, actually, the blood clot from just like being on birth control pills may not agree with your oral estradiol that you're on right now, right? Like, and so we're searching, we're grasping for knowledge and education, and we want that community. And unfortunately, I feel like our traditional healthcare system fails us in some ways. And so I really wish that we felt empowered to really have more touch points with our healthcare team. And if we don't feel like we have that support, then get some help elsewhere.
Mm. There's so much to unpack there, and like Taniqua, you and I have had so many conversations around the fact that physicians, not only are patients not aware, but physicians aren't, and so it's such a complex problem because it's like which came first, the chicken or the egg? If the physicians don't really understand menopause fully, so do you? I'm just kind of curious, like based on the kind of explosion, the M factor, all these things, and the heightened awareness around menopause. Like, if you were to give like a timeline, this just is coming to me extemporaneously, by the way. Like, what would you imagine the timeline would be where physicians, the OBGYNs would have greater training beyond the Menopause Society?
Well, I think we're seeing it. I think that, for example, the Menopause Society conference officially starts tomorrow. In person was sold out within weeks. I've never been to one of these conferences when it's been sold out, where you literally have a packed house. So I think that there is definitely that increased interest. I know that membership in the Menopause Society has gained, like, just like taken off. And I do think that there is a recognition for residency programs. You know, the study that originally looked at it said only 1 in 5 residency programs actually had any sort of like dedicated midlife health training. All residency programs have to have some menopause physiology and education, but now there's a bigger awareness of it. So I do think that it's growing. I think what's going to be the sticking point, though, is time. One thing that I've learned, again, I'll use pregnancy as another model. You have like this whole intake where I used to work as an obstetrician. Your first OB appointment was almost an hour. You went over everything. There were booklets that were given. There was so much information that was given about what to expect. And then you literally followed up in 8 to 10 or 12 visits afterwards. And so what that does, or the hope is that not only are you gaining in knowledge, you're gaining in confidence, but you're gaining trust with your care provider. And I would say the same thing, if not more, should happen also in the menopausal transition, where you're having multiple touch points that as you're changing and as your body's changing, regardless if you're on treatment or not treatment, whatever it is, that you have that ongoing support because that is what fosters the most in the way of trust. So I do think that you're going to have more folks who are going through the training. You're going to see more people graduate out of residency with a little bit more understanding, but the system has to shift to be able to provide the time and the access for patients to actually build those relationships so critical as women are navigating this change.
Yeah, and I think you make a great point, Taniqua, in terms of the system has to change. And that's such a behemoth thing to move. If we can move it in a micro way, a little change is a lot of change. So thank you for that. I did want to sort of understand your thoughts on that. We're going to move over to Dixie, who Dixie Lincoln-Nichols is a biological science and health well-being educator and the co-founder of Life in the Pause, a platform dedicated to transforming the aging and menopause journeys into empowered and celebrated experiences. Her work focuses on helping women navigate major life transitions, such as menopause and growing older with confidence and vibrancy. Dixie is also an Under the Sisterhood advisor. So, Dixie, welcome. And I'm excited to ask you this question, which is menopause is often viewed through a purely medical lens, but your work blends science, it blends self-care and soulful living. I love that. How can women cultivate a mindset that celebrates transition as a time of renewal and growth? You're on mute. Yeah, you've been on mute.
There you go. Okay. Could you just read over the
Yes.
last part of the question?
I can read the whole thing over.
Yeah,
Menopause
you can read
is,
the whole thing.
okay. Menopause is often viewed through a purely medical lens, but your work blends science, it blends self-care and soulful living, which I love. It's so you. How can women cultivate a mindset that celebrates the transition as a time of renewal and growth?
Yeah, such a good question. I think most importantly is being present with this experience that we're having because it's unlike any we've had before, and one that has the least support, like Dr. Taniqua said. And so we have to be present with what we are experiencing, tuning into the sensations of our bodies. Like, what am I feeling? And not ignoring what's happening to us. I know so many women I've spoken to my friends and just, women who are experiencing menopause, and they all say, I feel strange. I don't feel like myself. Something's happening. What's going on? I feel like I'm going crazy. And surprisingly enough, a lot of women ignore that, right? I felt that way. I have felt this feeling of who am I? Like, what's going on with my body? Why am I feeling this way? And it's only when I connect with who I am, like I pause, stillness, and I connect with the sensations of my body. Like my head is actually hurting me. This is not in my head. It's actually hurting. Or my ear is aching or it's ringing. This is not something that I'm making up in my head. When I connect with those sensations in my body, I'm able to come into awareness, I'm able to acknowledge, and then I'm able to take action. So I always say that in order to make decisions that are sound for yourself, it really does require awareness. It really does require trusting what you feel at all times. Because again, because this is so new, so many women don't trust what they're actually feeling. Even when they're feeling it, they're like, maybe it's all in my head. Maybe that earache is just a one-off thing, but then it happens again and again, and women still ignore it because they feel like it's just me. And then when they begin to talk to others or they tune into experts like Dr. Miller or other experts that are on the internet, et cetera, they realize, oh my God, it's not just me. This is actually happening. And then the thing to do next would be, of course, to take action. But a lot of women don't because of the stigmas that are associated with menopause and the taboos that are still very much there. In as much as there is so much conversation around menopause, I am surprised at how many women are still ashamed to say, I am experiencing menopause, or I have low libido, or I have night sweats, or whatever it is, women are still so very much ashamed to even have the conversation with their significant other, whom they are in such close proximity to. So again, all of it stems back to being in awareness of what's happening to your body, acknowledging what's happening to your body so that you can take the appropriate action, whatever that is, whether it's HRT or whether it is going the natural route, whatever you decide, be in awareness, acknowledge, and then the action would come.
I love that. Well, just knowing you, you are so in awareness of your body with all of the work you do. But I think what's interesting, what you kind of hit on, Dixie, is like in a way, we almost gaslight ourselves in this transition because there's so much shame attached to the feeling we're feeling. And also there's almost not, even though it manifests physically and you can feel it, it's hard to articulate what that means to you. You know what I mean? And so
Yeah,
so
yeah.
I think it's really interesting. I mean, that's how I was hearing a little bit of what you were suggesting.
Yeah, certainly. I think it boils down to self-care. And I am a sucker for self-care. Self-care is my jam, and I've been nicknamed the self-care connoisseur, which I kind of like because everything I do is grounded in self-care. But we have to look at menopause as, I don't want to say something natural. It's every woman will experience menopause for whatever reason, right? Maybe it's because of ovarian insufficiency, maybe it's because of cancer medication, what have you. We'll all experience, every woman will experience menopause. So running away from it and ignoring the fact that it's happening is not going to help the situation. So again, tuning in I cannot think of anything better to say other than tuning into the sensations of your bodies, because that's where it begins. Ignoring that you are feeling the way that you're feeling will not lead to solutions, right? And then when you do acknowledge that something's happening in the body, it becomes easier to seek support, to whether it's from a menopause specialist, whether it's from your OBGYN, whether it's from a community organization or advocate that has resources around menopause. I think the action begins once you acknowledge that that's what's happening. But until you do, it's you, you're just sitting there feeling the pain, suffering, because a lot of people are suffering during this time and not acknowledging that they need help. Yeah.
No, I think that's great. That's really true. I think acknowledgement's critical in terms of moving things forward. We're going to move to Tiana. Um, Tiana Bowman is a two-time breast cancer survivor, menopause advocate, and the founder of Positive Outlook, an outlet for healing and sharing her own journey that has evolved into a platform that empowers women, especially younger survivors, to navigate life after cancer and the complexities of medically induced menopause. Tiana is also the advocacy engagement lead at Under the Sisterhood. And Tiana, welcome. I love this question. You faced tremendous physical and emotional challenges as a two-time breast cancer survivor. How has that experience shaped your perspective on menopause healing and women's health overall?
Well, first, thank you so much for having me here, Elizabeth. I love these conversations. I love the platform. And as Dr. Taniqua mentioned, the fact that you bring in voices from across the perspective makes such a big difference. So thank you for having me. And I guess to jump into that question, um, my perspective has shifted in quite a few ways. I mean, on the surface, being diagnosed with breast cancer at 35 took away the feeling of invincibility that I had, and that I think most young people have when I realized that something as scary as breast cancer could happen to me. It really did shift my perspective on life completely. But I would say after going through all of the treatments and going into medically induced menopause because I had hormone sensitive breast cancer, it really opened my eyes to what menopause is. I actually did not have an appreciation for what perimenopause or menopause was until my oncologist said, okay, in order to prevent the risk of recurrence, we should either remove your ovaries or suppress them. And when we had that initial conversation, I just thought, I'm going to have a couple of hot flashes. I've already dealt with some of those during treatment, and I can handle this. But I had no appreciation for how far reaching the symptoms of menopause are. And I didn't understand that it would be an emotional and a physical journey for me. And I think there's still so much to learn. My perspective is still shifting. And as I learn more from a younger survivor standpoint, that younger women under 50, are actually being diagnosed with breast cancer at almost 2 times the rate on a year-over-year basis than women over 50 with breast cancer. And, hormone deprivation continues to be the gold standard of care. We have a growing generation of women who are dealing with the symptoms of menopause in isolation. I think what Dixie mentioned about knowing what's going on and acting on it is critical. But I think that there are also survivorship dynamics at play as well that I've experienced. I have some survivor's guilt, and it took me a while, even when I was dealing with some of the symptoms like dizziness and heart palpitations, that I wasn't sure had to do with menopause. But I remember waiting just a little bit before asking my doctor what could be happening because I didn't want to be a difficult patient. And I didn't want to seem like I was ungrateful for being a survivor, because that's a gift in and of itself. But, menopause looks a lot of different ways, and it can be tough to manage. And with some of the symptoms of hormone deprivation, like, osteopenia and heart disease, and changes from just an overall quality of life standpoint, kind of being fast forwarded in younger survivors. Um, what has really given me pause and has shifted my perspective is that we need to have more conversations about what life after cancer looks like. And I think what Dr. Taniqua mentioned really sparked something in me from a pregnancy standpoint. Having that initial appointment where, women are being told, I remember when I was pregnant, being told this is what to expect, and having all those check-ins, it's like, okay, I have a roadmap. But a lot of times from breast cancer perspective and from my own perspective, having just an initial conversation where it's like, okay, we're going to suppress your ovaries. Any questions? Here are a couple uh, webinars to listen to, and let us know if you have any questions. Like, I felt so lost. So there's a lot to be done. Still, I'm encouraged that we're moving in the right direction, but there's still so much to be done. And I think menopause is a really broad conversation, and understanding different perspectives is very important. So, yeah, I am encouraged that we're moving in the right direction. But again, we still have to have more conversations in this place.
Well, thank you for that. And I just want to share that, you're my hero, the way you approach all of these. And that's, when I said I love this question for you because of the way, the resilience that you show. I'd love to poke a little more about that, Tiana. You've been doing all this work. You've been in Washington, and I forget which advocacy group you were with, but it would be great if you could share a little bit about the work, because I know it was not just about breast cancer, it also aligned with, medically induced menopause. So it would be great if you could share a little bit about that.
Yeah, I'm involved in a lot of communities, and that has actually been a part of my healing process. So I am a volunteer with the American Cancer Society Cancer Action Network, and was recently on Capitol Hill lobbying for um, increased funding for cancer research through the NIH, as well as funding for extending the Affordable Care Act tax credits. And so it feels very empowering to be able to use my personal experience as an avenue for driving change. And we can all do that. It's more accessible than I expected, and maybe to others. But there are a lot of other organizations that I'm part of as well that are moving the conversation forward, from just an experience standpoint. The Breasties is one that focuses on women who have had breast cancer or gynecological cancers under the age of 50, and they expand that conversation to pre-survivors, survivors, thrivers, and caregivers, which I think is important in understanding the overall perspective. And then with the women's health advocates, I'm also involved there. And that group is very passionate about menopause education and moving the ball forward in terms of getting, you know, front of mind for our congressional leaders, and making sure that physicians are learning more about menopause, and that there are continuing education credits that go towards that. So lived experience has driven my advocacy, and I'm thankful for that.
Yeah, I think lived experience is not to be underestimated when we think about, and I'm looking at Dr. Taniqua, you're going to be the next question, but I think what's interesting about lived experience, when you couple that with a clinician's experience or expertise, suddenly you start getting into real world evidence potentially. And so I think it's really, really important. So Dr. Taniqua, I like this question because we're going to delve sort of into the many aspects of menopause, but many women experience years of symptoms, before realizing they're in perimenopause. What early signs should they look for, and how can they better advocate for themselves at this time?
This is going to sound hilarious. I'm going to start with a story. So, and some of you on this platform know that I was a caregiver to my mother who was diagnosed with metastatic lung cancer. She lost the ability to walk. And so it was a very not just like emotional journey, but physical journey, lifting her, cleaning her, things like that. And after she passed, there was a period, and I remember it very distinctly, of 3 months where I just felt like not myself. I felt achy in my joints. My mood was crazy. Like I was like raging. And I would always joke that it was like I had a bucket of popcorn and I was just watching myself like, wow, you just lost it. Right. And there was nothing that I felt can handle. And I kept chalking it up to grief because here's the thing. In this midlife transition, we have a lot going on in our lives. I always reference that U-shaped curve of happiness, right? And when you're in your 40s, you're at the bottom of the curve. And so you just think it's life, right? Like whether it's mood, whether it's your sleep is off, whatever it is. And it occurred to me, here I am, a whole menopause specialist. This is what I do. I have like the spidey sense to recognize it in other patients, like, girl, this is menopause, right? Or perimenopause. I could not see it in myself. And I literally one day looked at my husband and I said, I don't feel well. And I think that this is perimenopause. Now, I'm 44 years old. My mother was menopausal by 42. I knew it was coming, but I didn't have enough in me to look up and say, oh, it's my turn now, right? And so hormone therapy was going to be part of my journey. I knew that. And so I dipped my toe in hormone therapy, and lo and behold, I felt better. And I was like, so I guess it was hormones, right? So I cannot even imagine if you had someone who does not even have that awareness, they're not living and breathing perimenopause in a very evidence-based scientific way. They just don't feel well. So I always say, you live in your body, right? You know you're normal and you know what stress feels like. You know the tools that you've had to be able to cope with those things, and you know what feels normal in your body. So it goes back to Dixie's like sense of like awareness. When that starts to shift and you no longer feel like yourself on like a very fundamental, how do I see myself in the world kind of thing, then I think that that warrants a conversation. At least a conversation. Because what we do know in early perimenopause, we don't really start seeing the menstrual cycle shift. I think one of the challenging things about the menopausal definition is that it's a clinical definition and it's a retrospective definition. It's 12 months of no menstrual bleeding. So most people are focused on when is my menses going to stop, right? But we know that we start seeing those hormonal changes even before the menstrual cycle starts having those breaks. In fact, when you skipped about two periods or greater than 60 days, that's actually considered late perimenopause. And so when I think of that, it's really when you start feeling that something is shifting, that the tools that you had to be able to deal with adversity, they don't seem to be working anymore. Sometimes it's that subtle sleep disruption where maybe you get to sleep okay, but then you're up at 3 a.m. and there's nothing going on in your brain, but you're up. Sometimes you'll see some cycle changes. They're still coming monthly, but maybe you're noticing that it's a shortening of the cycle before you actually get the lengthening of the cycle and a host of other things. But one of the first things I always say is check in with your body. You live in that body. You've been with it for as long as you can remember, right? And if you feel like something is shifting, have the conversation. And I will tell you, a lot of patients say, well, I just got labs and everything was normal. And so we know that labs will be normal, right? Like I could have told you that if you're having regular periods, it's going to be normal. That's why they're not as helpful, but that doesn't mean that your symptoms and how you're feeling doesn't need to be addressed. So finding that partner to have a conversation with is going to be really important as well.
Yeah, no, it's so interesting even hearing this conversation because I know for me it was 10 over 10 years ago that I was going through perimenopause and they didn't even have the word back then. It wasn't even discussed. And so we just went through it and we soldiered ahead. And I think what's wonderful about, I'd say, I don't know if it's today's generation, that the women who are going through it now, the women who are aware of it, and there is conversations happening. I guess what I'm kind of curious about with that, Dr. Miller, if you can explain as well this period of perimenopause, and I'd like for you to sort of uh, go through perimenopause, a little bit of menopause, and then into post. And the reason why I'm asking that is because the transitions and the feelings, the physical manifestations, the symptomology, how does that evolve through perimenopause through post?
Yeah. Well, so perimenopause on average is about 5 years for being leading up to the menopause and then that year after. So that's kind of the median age. And in the United States, menopause itself, it's about median age of 51. And if we look at that, that means that most people are experiencing symptoms kind of in their mid to like 45, 47. But again, this is like averages. So there's a bell curve. So you're going to have people who are falling on the earlier side of that. And we know that there are some groups that are going to experience symptoms very early. So now we're looking at, mid to late 30s, and those symptoms can last like 10 plus years. And so when you see that, right, it can be really hard to know what's what. And there are certain like clinical criteria, like if you have somebody who's presenting with skip menses and things like that before the age of 40, they do need an official like evaluation and workup with lab testing. If you have patients who are between 40 and 45, if they stop having menses, then yes, that is considered early menopause. And the general recommendation is that if they are candidates for hormone therapy, to consider that because there are some long-term data showing worsening cardiovascular outcomes, as well as bone health outcomes, as well as neurocognitive changes, right? But what we find is that perimenopause in and of itself is broken out. Right. So we'll see there's this whole like classification called SMART. I won't belabor that, but simply, we have the early stages where menstrual cycles are still relatively normal. You might get some length variability. You might get some quality changes in terms of how you're bleeding, what the bleeding looks like, feels like, that sort of thing. But that's when you're starting to see those subtle changes, those sleep disruptions, maybe those mood changes, and what have you. Maybe some weight gain. You start seeing that visceral fat deposition, body composition changing. When you get to greater than 60 days of no menses, you're now moving into that late perimenopause. And that's when we're getting more of the symptoms like hot flushes, night sweats, brain fog, so some concentration focus issues. And you kind of know, okay, this is perimenopause, right? Because it's not subtle. Like you're literally breaking out in a sweat with any sort of core body temperature elevation. And your periods are literally like changing, like you're not having them as frequently. The menopause is like a day. So it's defined as 12 months of no menstrual bleeding. And so I find the significance of that honestly has to do if you have bleeding beyond that, right? So if it's like 14 months and you have bleeding, it would warrant an evaluation to make sure that what's going on with the lining of the uterus. And so I always recommend, don't chalk it up to, oh, I guess my period came after 18 months of not having one. I would definitely want to be evaluated. But then that's when we're starting to see some of the other more cardiometabolic changes that have an impact for cardiovascular health. We know that after the menopause or before the menopause, there's a 50% risk reduction having estrogen present from cardiovascular disease. After the menopause, we're now actually matching male risk factor to some extent. We start seeing bone health decline. We know that we reach our peak bone density, late 20s. There's that slow decline, but then there's that precipitous drop off around the menopause. And that can have some long-term consequences, especially if you have pre-existing conditions or genetic risk factors that put you at risk for development of osteoporosis and all of the morbidity and even mortality associated with that. So in the post-menopause, there's a lot of fun, like most people, their symptoms will get better, right? Like when we think of hot flashes and night sweats over time, the vast majority of patients, not all, will have some improvements to those symptoms, but there are some worsening symptoms. So like I said, some of those cardiometabolic parameters, really making sure that we're being really vigilant and diligent in making sure that we're controlling our chronic medical conditions. So we're starting to see hyperlipidemia, we're starting to see more insulin resistance, and making sure that we're paying attention to that and making the appropriate lifestyle changes and potentially medical interventions to help maintain that, because that is what's going to be the big thing as we're looking at later life, as we're looking at the risk for dementia, Alzheimer's development, and all of those things.
I really appreciate that. Thank you for sharing and taking us on the journey. I want you to know with what you just said, I think what's interesting with postmenopause is your comment around you'll stop feeling the symptomology. What's interesting to me is with all of the other risk factors for postmenopause, like bone health, cardio, brain health, you don't feel those. Those are like asymptomatic in a way. And so I think it's really interesting, the juxtaposition. On one hand, you get rid of the things that are the excruciating, the things that really make daily living difficult. But there's these underlying things. And I think it's important to cite that because, taking care of that is really.
And just as an add-on, because I don't think it gets talked about enough, is that while you're probably having an improvement in some of those systemic symptoms, so we know the studies show that, like for a good portion of women, like brain fog, for example, that improves, or the vasomotor symptoms that will improve. But what we do know is progressive is the vaginal symptoms, the vaginal and urinary symptoms, known as like the genital urinary syndrome of menopause, constellation of symptoms of vaginal dryness, urgency, frequency, frequent urinary tract infections, which could be deadly, right? And so also understanding that that becomes more of a concern later on and really should be addressed, like should come up. I will tell you, as a gynecologist, I love asking about the vagina. And I will tell you that I have patients who they will come in and they have been uncomfortable. I always say, do you have an awareness of your vagina? You're not supposed to be thinking about it, right? And if you have that awareness, then we need to fix that, right? Because to me, it's a bigger issue of, like life and death when we think about the increased risk of recurrent urinary tract infections and urosepsis and how that can lead to altered mental status and death.
Yeah.
Thank you for that. That is really important. This is really educational. I really value this conversation. We're gonna move to Dixie, and I think this is interesting because Dixie, you and Monique created the company Life in the Pause. And it's such an empowering concept, embracing menopause as a new beginning rather than an ending. What inspired you guys to create this platform, and what does living in the pause mean to you?
Hmm. Oh, well, this all came about because of our own desire. Dr. Taniqua said earlier, I think she mentioned the word yearning. And that's exactly what we were feeling, a yearning for information, for community, for conversations like this conversation we're having right now. It was during the pandemic, Monique and I were meeting for a project, had nothing to do with menopause. And we met every Wednesday. And every Wednesday we met, the conversation veered toward menopause, what she was experiencing, what I was experiencing. We weren't talking too much about it with our own circles. So we found each other and started to offload on each other our experiences. And we realized, and I mean, we went on like this for 2 years. For 2 years, we were meeting most Wednesdays, and we were setting aside an entire hour to talk about what the week was like, what we were feeling, what our frustrations were, what we were seeing out in the landscape, what we felt was missing, what we felt we needed, what we wanted to see more of. And then after 2 years, I sat and I looked at her one night and I said, you know, we're onto something, right? Like, do you see what's happening here? Like, you've given me permission to speak more, and I've given you permission to speak more about what you are experiencing. Think of how many women are out there who need permission and want permission to open up about what they are experiencing. And so we went down the rabbit hole and we decided to start Life in the Pause. And we look at this company as not just a menopausal company. Because we are more than our menopause experience. We are women who are growing older, and we want to be present with the process of getting older. We want to be able to utilize the wisdom that we've gained over the years to make an impact in our own lives and the lives of others, like we're doing with Life in the Pause. And so living in the pause means being in gratitude for having come this far and being in gratitude for having the presence of mind to speak up about what we are experiencing, being in gratitude for conversations like this and platforms like these, being in gratitude for community, being able to turn to whether it's my friend or whether it's Dr. Taniqua or whether it's you or whether it's someone in my family to ask for support. Living in the pause means showing up as our full selves with everything that's happening to us, with everything that's transpiring. So it's with the pain, it's with the discomfort, it's with the joy, it's with the weight gain, it's with everything. It's with the education. And with all of that, we hope, the hope is that we eventually get to a place where we can take the appropriate action for ourselves. And it will always come back for me to being in awareness, being I'm telling you, it comes right back to that. Being in awareness of the sensations of my body, but also being empathetic to the people around me and not only thinking about what I need, but thinking about what they need as well. So thinking about what does my husband need as I navigate this transition? What do my children need as I navigate this transition? How am I showing up for not just myself, but how am I showing up for them, my colleagues? How am I showing up because of all the changes that are happening in my body? I know other people are inadvertently being affected, and I need to be so very cognizant of that. And again, tuning in so that I can understand how I need to show up, the help and support that I need so that I can support them and them help me get through this. Oh, no, I don't want to call it a situation. This rite of passage, because it's not a situation. Yeah.
Yeah, I like the rite of passage. And Dixie, I really, ever since I learned about life in the pause, when I have those moments, I think a lot about pausing. And I know that you do a lot of different things socially to pause, to pause and give tips. I think that that's what, like, so I think it would be great for you to share a little bit of those I call them offerings or, you know, because I think they are tips, if you will, to sort of self-acceptance,
Yeah.
acknowledgement, self-awareness, and being in present and in your body.
Yeah, yeah. I think being in awareness can guide us to what we need. And so whether that is proper nutrition, whether that's movement for our bodies, whether that's a restorative practice, whether it's working on improving relationships of all sorts, whether it's significant other, children, co-workers, community relationships, recreation, which is so very important during this time. And even like one big thing I have found is finances. Oh my word. So many women are so stressed about finances, and especially during this time, it creates a bigger burden and a bigger toll on the body and exacerbates stress. So something like petite pauses. So I have this thing that I do with my community members. They're called petite pauses. And it's exactly what it sounds like. So it's not 5, 10 minutes of a meditation. It's 1 minute, 2 minutes, 30 seconds of pausing and nourishing your body in some way. So it just might be for me looking up at the clouds outside, just looking at the formation in the clouds. I'm like, oh my God, I see a lion or a tiger in the clouds. That alleviates some of the stress that I might be feeling in the moment, or people watching, or having a cup of tea, or maybe saying a mantra or an affirmation. Maybe do 30 seconds of a diaphragmatic breathing exercise to reset our nervous system, to move us from that fight or flight over into that rest, repair, and digest mode. Anything that can anchor us and root us and ground us, even if it's for a moment, is is important, and it is beneficial to our health and our well-being. And so a petite pause can be done many times throughout the day, in your car when you're about to curse somebody out for coming in front of, like cutting you off. Like, you take a petite pause and you take a deep breath and relax the chest and let the breath sink all the way down into the belly, right? So again, but we have to be in awareness of how we're feeling and the things that are triggering us in order to even activate a restorative practice. Because if we're not in awareness of how we're feeling, reaction is so much easier than response. And
Mm.
so being with your body constantly is what's going to guide you through making better decisions, not always the best decisions, but better decisions for the support that you need on a day-to-day, on a moment-by-moment basis.
I love that. I love the self-care. I love the in your body as an individual, but I also love the fact that you've created this community. So it's both individual and collective. And so, looking for like-minded people who are experiencing that. So it's wonderful. We're going to move on to Tiana. Many women with a history of breast cancer face unique challenges managing menopausal symptoms. We're kind of curious, what strategies or support systems have been most helpful for you, Tiana, navigating this stage?
Yeah, this has been a very iterative process, but I would say that I've leaned a lot into books. There's a lot of great information out there, just as a starting point, so I could understand what questions to even ask, understand some of the symptoms that I was experiencing, and connect them to the menopausal journey. It's been very helpful for me reading like the Menopause Manifesto, the new Menopause. There's so many physicians who are coming out with books and helping to put words to some of the questions that I've had. And by doing that, I think that I've become a better partner with my care team, because I'm not just coming in with, I think this might be happening. I'm coming in with questions like, I'm reading that there is some thinking that's shifting around hormone therapy and breast cancer patients. What is an option for me? Is there an option for me given the ongoing treatment that I'm currently having? And in some situations, just as an example with vaginal estrogen, I kind of had to be the bridge between my gynecologist and my oncologist, in a good way, because um, from an oncology standpoint, really making sure that recurrence risk wasn't taking an uptick was critical. And then from a gynecology standpoint, being protected from a vaginal tissue standpoint, and the changes that I was experiencing was also something that my doctor cared for with me and wanted to make sure that I wasn't struggling through. And so we had to do a little bit of trial and error with how much I was taking, and my gynecologist and oncologist had to be on the same page with the dosages that I was taking. And that was an example of me becoming a better care partner for them. I mean, our doctors are so knowledgeable in what they're doing, but humans, and we all want to work together and come up with solutions together. And so using books as a starting point to just put words to some of the symptoms that I was dealing with has been critical in my support space. I would also say that community has also been key. I'm a part of multiple organizations, like I mentioned, but also a local breast cancer organization that I'm a part of has a very active Slack channel where there are multiple topics around hormone therapy, around fertility, around career changes that women are wrestling through, around just getting together and talking about survivorship. And I've learned a lot just by reading some of the other experiences that co-survivors and thrivers are having. And that has also impacted my perspective and has made me ask questions about what I could be doing for myself. I've started Reiki therapy. I've done sexual health and wellness therapy, which was more healing for me than I anticipated because of the mind body connection that it thankfully forced me to revisit. There within the breast cancer process, and I think we may have talked about this, Elizabeth. I realized that there was a point where um, I took on a lot of mental numbness because I just got so accustomed to taking off my clothes. It didn't matter which doctors came in, and it's like, just fix me. My body is no longer sacred. It's just something that needs to be fixed. And losing that connection had more of an impact than I appreciated until I started doing sexual health and wellness therapy. And so I would say that, for any survivor, whether you're in a relationship or not, it is important. It's hard because of how our bodies change, and what we see in the mirror doesn't always reflect how we feel inside, and it can be very triggering. But I think reestablishing that mind body connection has been critical for me, and it's something I would completely recommend for others. And then the final piece that I'd say, just to build on the community piece, is that there are platforms that really do drill in on menopause and breast cancer and what that journey looks like. There's a platform called Menopause and Cancer out of the UK, and they host very critical conversations around just different areas from a survivorship standpoint, bringing in doctors so we can better understand what's happening with our bodies. And so that's a podcast that I lean on pretty heavily to get some information as well. But just always being open to growing, trying things out, shifting my medications, and understanding how technology is changing is something that is very important to me.
I think, thank you for that, Tiana. I think what's amazing is like, I mean, you're an incredible advocate. You're so educated and you know how to advocate for yourself. And that I think is advocating for ourselves as women. All right, you are a breast cancer survivor. You have to advocate and understand your body in a different kind of way. Then add the layer of menopause. You have to advocate so you understand the correlation between the two things. But then when we look at us as women going through this entire phase and layer all the different things that go on, like the advocacy, you've learned so much in terms of becoming like a tremendous advocate for yourself. And that's something like as women, I think this is a great learning, role modeling that for next generation, like really teaching how to advocate and make sure you go in with not just the right questions, learning and feeling confident enough to be able to have that conversation. And I'm looking at Dr. Taniqua because she would be open to it. Not all physicians create that sort of warm environment to have it, but I think I just want to give a shout out for that because it's really important with everything you're going through. And then I think as well with the menopause, back to what Dixie was saying, that acknowledgement and that self-awareness and really in doing that and acknowledging, you can go in and drive action. And so Dr. Taniqua, we're going to ask you this question. I think you built a little bit and that was my bad because I sort of probed and poked. But one of the things, is beyond symptom management. When we think and we think about long-term health considerations post-menopause, if you will, like bone, brain, and heart health, what should women be thinking about as they move through this phase?
I get this question a lot and more from like a prevention standpoint with so much of the conversation around hormone therapy and menopause, especially since there have been so many subsequent studies that have kind of I wouldn't say they debunked the Women's Health Initiative. The Women's Health Initiative data was what it was. How it was interpreted more broadly was probably incorrect. But we have lots of data that show that maybe for people who are candidates for hormone therapy, it might show some benefit, especially based on what we call the timing hypothesis. So I get a lot of questions about like prevention, hormone therapy and prevention. And what I say is that yes, we know, like from a biochemical physiologic, that the presence of estrogen acts as an anti-inflammatory agent. It acts on multiple different systems. I think there was a question in the chat, as I mentioned, dementia and Alzheimer's. Yes, we do see for early adopters who are right in their perimenopausal transition that there may be some neurocognitive benefits because of the role of estrogen in the prevention to some degree of the tangles that create those like amyloid plaques in the brain. In the case of Alzheimer's, we see that in terms of cardiovascular health, the presence of estrogen disrupting the deposition of the lipids and the calcium in those atherosclerotic plaques. So we see that, right? But I also say estrogen is not your get out of jail free card. We also have to take care of our bodies. So what does that mean? That means that, yeah, our like nutrition shifts, right? We're paying attention more to getting fiber, to making sure that we're restoring our gut microbiome, to making sure that we're doing all of the things that we know we should do, but it's really hard, right? And so, well, I always frame it as like it is one of the many pieces of the toolkit to having a thriving, second act, as some folks will call it. What we do know is that making sure that we're managing our chronic medical conditions and keeping them optimal is important. So understanding that if you have, hypertension or if you have hyperlipidemia, and I get this a lot, I'm not taking that statin pill. I'm like, okay, well, we're just going to have, high cholesterol. And I don't care how much estrogen you're on, you're still going to have those baseline cardiovascular risk factors. So how are we taking care of those chronic medical conditions? Aerobic exercise and really doing the work. Oh gosh, doing the work of divorcing exercise from weight loss. Women have been drilled that you go on the treadmill or you exercise so that you can stay small or so that you can maintain your weight and stay thin. And exercise and movement is just good for your body. And aerobic exercise, especially when you're looking at cardiovascular, neurocognitive, and bone health, like when you're thinking about resistance training, for no other reason than your body needs it. The American Heart Association recommends at least 150 minutes of moderate intensity exercise. That can be going out and walking the dog and not, and it's also the bonus is you actually get to be outside in the sunshine, right? And look at the clouds, like Dixie said, and go see the bears and the lions and tigers and bears in the sky. And so that's also important. And then the final thing, and this is not me saying this, I actually had to like do a presentation on this and I was shocked. Engagement, engagement. And so what does that mean? That means that we don't retire to do nothing, right? I see a lot of people, they're like, oh, loneliness is an epidemic in our country. You mentioned the UK, Tiana. They actually have like a department, I don't know if it's a department of loneliness. Like they are studying it as an epidemic for their elderly population. We know that when you are engaged, whether that's civic, whether that's religious, whether that is just, why do you think those ladies with the bridge club, right? We talk about those ladies and they get their little bridge game going every week. Yeah, why are they 90 years old and still playing bridge? Because they have engagement. And that has such an impact on how we experience stress, how we experience trauma. It is actually shown to improve neurocognitive health and help with the dementia risk. And so making sure that like we're keeping those three things, right? Like medical conditions, sometimes it's genetic, we can't help it, right? So making sure we're addressing that, making sure we're moving our bodies and really giving ourselves that cardiovascular, that aerobic exercise. And as we're thinking about bone health, that resistance to the bones with some strength training, and then remaining engaged, remaining a part of something, a part of the community, a part of something.
That's great. I think that's wonderful advice. And I like the way you described it. It's very accessible and really understands sort of the mindset of the person on the receiving end. I think of myself postmenopausal. I mean, I know if I wish I knew what I know now back then, I would have been on calcium. I would have been doing all these things. And so if we can do it preventatively, great. If we're in the mode, we should be doing it now to prevent even future worsening situations. So I think that's really helpful. Dixie, I'm curious, and this gets a little more into a different, whereas Tanika was more about the clinical side of things. What practical or mindset shifts can help women reconnect with their bodies and reclaim joy, confidence, and really purpose at this season of life?
Yeah, I like this one because I actually taught a class, the menopause lab, and one of the first things I taught was 5 mindset shifts that women should have during this time. So I'm going to share those. And of course, you know what I'm going to say. What do you think number one is?
Awareness.
Triple A.
Awareness, acceptance, action, acknowledge,
Awareness, acknowledgement, and
action.
acceptance and
Okay.
action. Awareness, acknowledgement, and action. Like, duh. Those three things, like these are the mindset shifts. So the first thing is to practice awareness, acknowledgement, and action. And awareness takes work. I mean, it may sound frivolous to some people, but it is one of the best things you can do for your body. And it takes practice. It's like building a muscle, constantly being in awareness. And that means not overlooking any little thing that you feel with your body. Any little thing you feel, stop, pay attention, give it some time, give it some consideration. I mean, you can move on, but if you feel it again, be with it, even if it's for a few seconds, right? That's awareness, what the gut says. How many times we move past that feeling that we have, and then we're like, I should have listened to my gut, right? And in the case of menopause, there are actual symptoms that are happening. But because we're not used to them happening, sometimes we tend to just ignore them and be like, it's all in my head, right? So I'll beat awareness, acknowledgement, and action, like a hammer on a nail. So that's the first thing. The second thing, of course, is to practice self-care. Take time for self. It is a source of empowerment. And it is the foundation of well-being as far as I am concerned. What do you need? Not what does everyone else need before what you need. What do you need first and foremost? And you get to think about what that is, right? You may want to write them down. You may already know. But once you know what you need, acknowledge it and then do something about it and then take the action. So self-care is super important because without self-care, we are literally putting our lives in other people's hands. And I think our lives should be in our hands and our well-being should be our first priority. The third thing is to seek support, ask for help. So many people are afraid to ask for help. They don't want to seem ignorant. They don't want to seem needy. For whatever the reason is, a lot of people will not ask for help. And I'll use my grandmother, for example. As a matter of fact, when you just asked me the question, I saw a text coming. She's not been well. And it just threw me off right away. Um, she was hospitalized 3 weeks ago, and I had a conversation with her, and I said, my grandmother is 91. And I said, "Are you feeling okay?" And she said, "Yeah, I'm okay." I said, "But you weren't breathing well." And she said, "No, I wasn't. But I didn't want to bother anybody." And that broke my heart, right? She didn't want to ask for help because she felt she was going to be a bother to her children or whomever, she might have decided she wanted to tell that she wasn't feeling well. And so a lot of women who are experiencing menopause are going through the same thing. They don't want to ask for help. They are ashamed, whatever the reason is. But again, that's another muscle you get to work. Little by little, ask for help from your partner, from your children, from your friends. Ask for help. And the more you ask for help, the easier it would be to continue asking for help, especially when you need the help. Some people don't ask for help. They'll go to their doctors for a checkup and they need something and they won't even ask the doctor for what they need. They'll leave that doctor's office without asking for the thing that they need to feel better. So practice that. Releasing expectations. Oh, this is a big one. And it was big for me because I expected menopause to be this thing that we all went through in the same way. And come to find out, no. Don't even look at your mama. Don't look at your sister. Don't look at your friend. Don't look at anybody. Just like focus on you because your experience is going to be a unique experience. So release expectations in terms of what it is going to look like. The vision that you have in your head for what this rite of passage is going to feel like, what it's going to look like, who's going to be there, who's not going to be there, what symptoms you're going to have. Like literally release them. And this is when you get to be present, like what is happening to me right now? What is my body experiencing? And again, acknowledge that so that you can do the thing that you need to do to feel better. And then be optimistic. That's the last point. Have some optimism. I know because we didn't know a lot about menopause, a lot of us moved into it very apprehensively, very scared, sort of like one foot in, one foot out. We're just kind of like, tiptoeing in. We don't know what to expect. We didn't know what to expect. And a lot of us realized we were in perimenopause in hindsight. But be optimistic. There is so much information now out there. Dr. Taniqua is a well of information. Elizabeth has all these interviews. Tiana is an advocate, well resourced, and there are so many others like the people who are here. And I'm sure the women who are listening are full of knowledge as well. So know that there is, I would say, there is a light at the end of the tunnel. And you don't even have to wait till the end of the tunnel to see the light because there is so much information readily available. So tap in to that, be optimistic. This can be a really good time. And if you get the support that you deserve, the support that you need, you can really coast through this. So get the education, which is important, so that you can make the right decision for your menopausal care and you can have the right tools in your toolkit like Dr. Taniqua said. And guess what? You can go traveling, you can do all the fun recreational things that you want to do. This does not have to be a season of wallow or woe is me all the time. Yeah.
I like that. Thank you, Dixie. And I like that it's
Mhm.
not a season of wallow, it's really a season of life. And I
Yeah.
think
And
reclaiming
well-being.
joy and
Hmm.
well-being. And so I think that's wonderful. And I like leaving with optimism. I'd add one thing, gratitude, because I've
Oh,
learned in
yes,
my
yes,
phase of life, gratitude, like
yes, yes. That's actually part of the optimistic.
yeah,
Yes.
oh,
Yeah.
absolutely.
Yeah.
So we have our last question for Tiana, which we want to know more about your platform, your company, Positive Outlook. You inspire women to find hope and positivity through adversity. What message do you want women to take away about resilience, about self-advocacy, and embracing life's transitions with strength?
I, you know, I think having grace, for ourselves is really the starting point. Because there's no right way to do anything, whether it's, being healing out loud and doing advocacy work or, being more reflective. I think the main thing is having grace for ourselves. And accepting kind of like what Dixie said, that there's a lot that we just don't always know. and that's okay. There's always a place to learn and ask for support. And I think by having that grace, it takes a burden off of our shoulders. And I think that that has helped me quite a bit. And resilience is, it's a great word, but it's a tough word because it means that we have to go through some hard things. And so I don't want to speak for everyone, but not all of us want to be resilient. But you know, once you can go through things, I think as long as you're surrounded by, and I'm very blessed to have an amazing husband and family and friend network who know me and who support me, and they have surrounded me and lifted me up through the hardest times. And so I know that when I'm wrestling with emotions or wrestling with making a decision, they have my heart and my best interest in mind, and the advice that they provide has really helped move me through this current season. And so I think with being resilient, it starts with really checking your network and the circle that you give your heart to, and who we receive information from, because again, to Dixie's point, I was literally writing down notes as you're listing out your points, but um we should hold our lives in our own hands, and be able to um you know move and make decisions in our best interest. But that's done by having a very supportive circle. And so I would just say try and surround yourself around people who really know and see you, to get through, the unexpected in bad and really great ways of life, because that makes a really big difference.
Yeah.
Wow.
Yeah.
I have to take a pause to
Mhm.
take this in, but Tiana, one thing that really struck me and what you just said was like thinking about resilience in that other way. Sometimes we don't want to be resilient. We have to go through those hard things, and it can be a condition, disease, it can be other things in life. And I think that is really an important thing to leave us with. I think that's so, thank you for sharing that. And I'm gonna I know this is a small group, but this has been an unbelievable conversation around menopause. I love the science, the humanity, the every aspect we've covered, from a from a personhood, and having Dr. Taniqua Miller. I think you're amazing because you blend the scientific, the rigor, the clinical with real humanity. So I really appreciate that. But I want to hand it over to Amy and open up the room if anyone has any questions.
Hi, everyone. Hi, ladies. I just want to also say thank you so much for being in this panel today. I definitely have taken some great takeaways with me from each of you, and some great inspiration and some knowledge. So thank you so much for sharing your stories and how you're inspiring women to navigate through all the different parts of our life stages, and how we can do that in such a way that where we can be thriving and supportive of one another. So I um, will take any questions over here in the chat, or you can raise your Zoom hand since it's a small group. We did have a question earlier that Smitha had to drop off, but she did ask here to Dr. Taniqua Miller. You mentioned dementia and Alzheimer's. Could you elaborate on that connection with menopause? So I think we can start with that question, and then if anybody else has has a question, please drop it into the chat.
Yeah, so I mentioned it a little bit about like the timing hypothesis and what we know about estrogen's role in terms of the plaque formation, amyloid plaque formation, which is really at the heart of the pathogenesis of Alzheimer's. And so we do know that it will slow that plaque formation. This is very basic, but like there are like these neurofibrillary tangles and which estrogen has a role in preventing that process from happening, or slowing down that process, or reducing the burden of that process. And so, what the WHI study showed is that it actually accelerated dementia. But the women in that study, the median age was in their 60s, right? That's not generally when we are initiating therapy for when we're specifically using estrogen therapies. And so the younger group, all of these women were menopausal. That's how they met criteria to be in the study. But the younger group, there was some protective effect. And also understanding estrogen's role as like an anti-inflammatory, that it's going to help with the prevention of atherosclerosis. Remember, Alzheimer's is just one type of dementia, but we also have like vascular dementia. And so, again, going back to making sure that we're taking care of those chronic medical conditions, whether that's hypertension or what have you, also to protect brain health as well as heart health.
Thank you. Thank you. Does anyone else have anything that they would like to, or even just a comment you'd like to drop in or share?
I was looking because I did make a comment earlier and I have to drop. I'm sorry, I got to go pick up the kids from basketball. But the idea of grief, and I heard a lot about grace and I heard about a lot about that. And even as someone like who is in perimenopause, I am actively going. I think I've been surprised, even as someone who has spent all my life, well, not my life, my like medical life, if you will, really in this space, being surprised that there is some grief that you experience. And I don't want to be 20. I don't even want to be 30. In fact, this 40-something-year-old life is the best. So I can't wait to see what's ahead. But it's this idea that, oh, I'm here now, right? And as much as I felt prepared, right, with my medical knowledge, it was like, oh, but my body is experiencing this thing and it feels very different. It feels very foreign. And so I think it's giving me a little bit more sensitivity to patients who really come and they are at their wits, right? Like they're just kind of like, I just don't feel good. I get it now. I get it. And I understand. And what does that feel like to walk that journey with her? To say, yeah, I get it. Let's make you feel better. But then the next transition is how do we embrace this is where we are,
I like
right?
that.
And our bodies will look different and it will feel different. And it's just squishy. I mean, I'm telling you, it's just squishy. And you're just like, this is where we are, right? And so, how do we, again, do the things that I said, make sure that we're maintaining our medical conditions, making sure we're moving our bodies, all of those things. And then having and acknowledging the grief, right? We got to acknowledge that, like, wow, here we are, we're at this place. But then how do we move through that? Kind of to your point, Tiana, like, I don't want to be resilient. Right now, I'm like, I don't want to be perimenopausal, but here we are.
I just want to say before you drop, Taniqua, Dr. Bernie Russell, we did some interviews on Under the Hood of Women's Health, and she talked about, I mean, she's an OBGYN. She's not a menopause expert, but she says, but I kind of am because I've been growing up with my patients. I delivered their babies and now I'm, post-menopause with them. So it's kind of interesting that you say that because your experience, your lived experiences as a human, and then add the clinical it's just gonna be really helpful to the patients because you'll have true empathy, not like make pretend. So anyway,